We're trying to make sure that we first are all in agreement as the amount that we're going to be spending over the next couple of years, but then
Rush is a fabulous place for a master's program in healthcare administration. We have everything under one organizational structure, one management team, and we integrate from the very beginning the educational experience with the culture and the management of the overall organization. There's nothing like it.
Prior to coming to Rush, I was in the Army, spent about 7 years on active duty, and I got out and I realized I wanted to get back to the veteran community and I really wanted to work with that population again. And when I found out about the teacher practitioner model and some of the other opportunities at Rush, I was sold and really wanted to come to Rush, work at Rush, and then use my experience here to take an academic medicine perspective to the VA after graduation.
We're here to develop student leaders, and student leaders actually recruit incoming students to participate in our committee structure. It gives them a sense of ownership, as well as it allows them to expand their management skills.
In my first year, I had the opportunity to do an interdisciplinary fieldwork project. That basically brought another HSM student, including myself, into a team with 2 nursing students. And the 4 of us collaborated to create a set of recommendations for the Scottish Home Assisted Living Facility to improve the turnover of their patient care assistants and their medical assistants, and to try and help with the workflow there in terms of that. The client was floored by our presentation. We really wanted to make a difference in the Chicago area community, and so I think they were really happy just to have these recommendations and to have someone that cared so much about it and that wanted to make their system better just as much as they did.
So I've had the opportunity to actually employ HSM graduates in my department here at Rush. I definitely find that the HSM graduates can jump into an ambiguous problem and start figuring out the pieces of information they might need to provide a solution or a recommendation. They aren't afraid to ask questions, and I think that's part of what we foster in the classroom, of creating an environment where questions are welcomed and appreciated.
The second year of the program shifts the learning from more classroom setting to experiential. The master's projects are an opportunity for a student to dive into a real-world problem that is affecting healthcare management, policy, and/or practice. And more those projects are directly relating to the community.
The work experiences that we're able to provide them, their first year, their summer, and their second year, at the end of the day, really gives them a full year's worth of work experience in healthcare.
After graduation, I was hired to manage a very exciting project called Building Healthy Urban Communities, and it focuses on improving the education, health outcomes, and employment for the west and south side communities of Chicago. It's helping us to create data infrastructure to pursue significant improvements in community health. The project that I'm working on and the lessons that I have learned from this project have helped me to shape the curriculum for this course.
Everyone involved with the program really values the mission that we're trying to accomplish, to provide better health care, to improve the health status of our entire community, and to give back as best we can.